Dr. Monica Bhagat, practicing ENT consultant and a CI surgeon in the city of Pune and an associate consultant at KEM Hospital. Good evening, ma'am. Thank you so much for giving us time. So she is Dr. Sampurna Ghosh, ma'am, a very well-known name in the field of ENT and cochlear implant surgery, and also a sleep apnea surgeon, as we all know. She's a full-time consultant at Medicover Hospital, very well-known national and international speaker at many ENT platforms, and has been a mentor at various hands-on dissection workshops. So we are here, ma'am, for just a chai pe charcha kind of a discussion.
Is this something very new and interesting?
Usually we don't talk about this part of the other side of being a female, well-established ENT surgeon, especially first of all in the first place a female surgeon. So what we see at the forefront is just being a well-established ENT surgeon, but what goes behind this is so many demanding jobs back at home, and then striking a balance between your home and at the same time professionally. So I wanted to discuss with you, like, how do you manage this, a demanding job at home and also a well-established demanding profession at the same time, being a ENT and not just an ENT and also a CI surgeon?
I think every woman can do that. That capacity every woman have within. You have to acknowledge that. If you read about the first lady doctor of India, from Kolkata, and she was mother of 5 or 6 if I am wrong, and after marriage only she went to study medical degree, and in her whole college she was the only one lady, and completely isolated. People thought why even she has come to study medical science, but against all odds she completed her study. She went to UK, and she had complete family support and she had trust on herself. So whoever has this query on mind, they should read about these ladies who initiated this kind of challenging journey. Even in UK, when the ladies started coming in the medical field, there was one of the pioneers who was disguised in male dress and started her practice like that. So there has been this misconception or atrocities long back, but now it is no more there. Now everybody accepts, and your patients will love you for your skill. So whether you are male or female, it doesn't matter at all. And I feel my maternity, being a mother, has never weakened me. Rather, it has made me stronger. So I never felt that as a backlog, or because of that I couldn't progress. So I will say my juniors or everybody to accept that very naturally as an organic process of your growth. That is also part of your personality growth, and don't think that it will hinder your career there. Of course, a few initial years you have to be more flexible in the time management. You have to select your good team who will support you, but eventually you will find your own path, and being a mother you will grow even stronger and better.
Right. And I think not to forget about the strong support that you get back at home, without which it is really difficult to go ahead.
That is true for both male and female doctor, both. Even a male doctor cannot grow the way he wants to if the partner is not understanding, because our career is dedicated for the society. It is not a 9-to-5 job. There will be odd hours, there will be demand. You have to interact with 100 people, and me being a very academic person, I love going to learn and to teach both. So I keep going to different cities and different countries. So whether at that point I don't remember whether I'm male or female. So when I see the other colleagues, also male colleagues who come to these conferences, so I think back home their wives also have to be equally supportive and understanding, otherwise they can't do. So it is not about wife or husband, whichever gender you are, your partner has to be understanding and respect your profession for what you are doing, because this profession is completely different and it demands some respect, it demands dedication.
Yes, yes, true. And usually this is the same point at which your career would peak up and would also demand equal expectation from the career as well, right?
Yes, when the child comes to your life, that is when you are started growing,
Yes.
and the child needs time. So both the graph
They go
goes
hand in hand.
and that is how we should enjoy it.
Yes. So I think that acts as a motivation to the mothers to work even more with more dedication and to do even more better.
Yes, sometimes I feel bad when I go for night stay outside and when I can't take my daughter. Many places I take, some places I can't take. But then I think it in different way, that what you are doing today, your sincerity, your professionalism, the respect you get from your colleagues, from your workplace, my daughter is seeing that. When a daughter or son sees what his or her mother or father is doing, that gets imprinted on them also. So it is not always what lecture we give, that don't watch television, don't do this, read storybook, go outside for playing. It is what you are doing, how you are behaving. So even today when I have a critical surgery, when I am going to give a lecture, whether it is a small forum or a big forum, I study 2-3 days before. I open my books, notebook, marker pen, I take notes with my laptop. So she knows, Mama, you are studying? I say, yeah, this is my studying. You are doing homework, I am doing homework too. So, but if I want to spend watching series in the television and tell her, no, you don't watch and you do this, that doesn't work. So what you are doing with sincerity, at the same time definitely I play with my kid, I spend quality time, but I want the child also to understand that how important this work is for me. This is like my worship. So and if you really do like that, children understand, and maybe in future they will also understand the importance of being sincere, being dedicated to whatever field they go in their career.
And many a times it happens that females, when they get into this process of getting into a family life, the career takes a backseat. And when you are raising a child, sometimes a kind of a break comes in your career. And once you are again back into a surgical profession, I think holding a knife in a hand comes with a lot of fears, a lot of apprehensions.
Yes.
So how do you get back to the track?
We have, it is true that little break, which is also the most pleasurable time of our life to be a mother, that definitely brings a big pause, a sudden pause. And those who are in government sector, maybe they get maternity leave, but I didn't get. If you are in corporate or if you are in private practice, you don't work means you don't get money. You are working in a team, you are taking a break of 6 months, after coming back you don't know whether the team is still there for you. So I had to start from scratch again, and 90% of lady surgeon do suffer a vacuum that time, that when to come back they feel like maybe I forgot the skill, maybe I cannot do the surgery like before. So we need to know from each other that you are not alone. We all have gone through that stage. Whoever successful practitioner you are seeing, whoever has been mother, they have also gone through the same phase. It is not your weakness, it is just a time, it will pass. It will pass on. So how I have recovered from that phase is I started going to cadaver dissection courses again.
Yes, that is very important.
Yes, I started going to temporal bone dissection, I started going to face workshop. Even though I have done hundreds of mastectomy before my delivery, but suddenly I felt no, I have to again polish, revise. I started reading again, and initially I used to call my seniors before the cases, look, this is the case, this is what I have planned, is the decision correct? Or wherever I have fumbled that maybe it may turn out to be difficult, I had luckily that strong network with whom I have studied in MS or with whom I have worked in Hyderabad. Sometimes I call a few of them, please come.
So you should not be apprehensive about contacting your senior surgeons.
No, you should not be. It is not only in this stage, all your life. A surgeon should not live in an island. A surgeon must have a strong backup team, That can be, may not be always senior, that can be with your friend, even that can be with your junior.
Right.
Sometimes your fellows, your registers, they will also give you strength. I keep asking them also, do you think I did this correct? Why do you think there is a perforation, it came back, where I went wrong? Or sometimes I tell them, if I want to read about a case and I am not having enough time, I just tell them, please read all the papers on this and tell me the extract. So learning is a two-way process. When you teach a junior, more than his or her benefit, it is more of your benefit.
Right.
You learn more.
Yes, right. That's absolutely right. And now talking about CN, obviously because madam has a passion for CS surgeries and we have seen her doing it so effortlessly. I mean, at this age, such a fine skill in cochlear implant surgery and such successful surgery, not just nationally and internationally. We had been seeing patients coming from all over the world to her. So I want to ask you, how was your journey as a cochlear implant surgeon when you entered into this practice as a newbie surgeon, and how is it now?
Yeah, so when you listen to this, remember it is not only for cochlear implant. You can probably apply this and change the name with any subspecialty. Suppose somebody wants to learn rhinoplasty or somebody wants to learn skull base, so you can replace the name. Okay, so here CI is just representative of one subspecialty, so-called little advanced otology, but whatever you want to learn, this is what to be remembered. So first of all, if you must have enough passion to learn that subject or to upgrade in that level. Like now my hospital got Da Vinci logo and a lot of people told me, you learn robotic surgery, will you learn? I didn't yet commit. I'm thinking, do I really want to learn? If I learn, what will be the utilization, what will be my learning curve? So spend enough amount of time to understand how much you are, from inside there should be a passion. No, I want to learn this. Okay, whatever happened later we'll see. First I want to learn, this is my dream. So you should close your eyes and you should dream after 5 years down the lane where I want to see myself as a surgeon. That I'm doing so and so case, or I'm teaching so and so case, or I'm going as a mentor. So I had that dream that I want to see myself after so many years that I'm doing cochlear implant individually, and I am giving the gift of hearing to the people who have lost that. So like that I started the learning, and as you already asked about being a mother, I could not do so-called 6 months or 1 year fellowship, but I kept going to my mentor, Dr.
Because that's not possible for everybody.
Not possible at all. So I went to my mentor, Professor James Hans in Delhi, and multiple times, and I learned. Every time I used to stay only 2 to 3 days, but multiple times. So I believe in layering the knowledge. You cannot learn everything at a time, whatever course you do. You may do 10 courses or long fellowships, still there will be lacunae. So as you learn to certain extent, then do case and learn again. So one by one layer, knowledge and wisdom and skill will add up. And luckily my mentor agreed to come to my center whenever I posted cases in the initial days. Till now, when there is challenging case, I discuss the detail. I don't feel ashamed to call him or any other senior for that matter. So you must ensure that safety is important.
Yes.
So risk taking is definitely needed to reach a certain level, but that risk, how much risk you will take versus how much you are going to lose, it should be balanced. Because if you do any complication in the initial days, then you are doomed. You will lose motivation, you will lose confidence. So definitely learn, try to do practice. Wherever you have doubt, call the mentor, take help, and make sure that patient goes home with 100% safety and success.
So irrespectively, the result is very important.
Result is very important. More important when you are junior.
Yes.
Initially only if you didn't do something right, then your moral will be completely down and you will earn a bad name, then you cannot progress.
So
in
the
that
choice of the
specialty.
the group of the patient that we are choosing is also important in those cases when you are a
Definitely.
newbie cochlear implant surgeon.
Definitely, you should not choose a patient who is 7 years, 8 years old, who have never used a hearing aid, or maybe very thin and mondini, or a very syndromic child. That is not ideal case to start with. Or even if you take that, you have to get a senior as your backup and do. Initially, you should start with normal cochlear anatomy, good nerve thickness, right age, and always give realistic expectation goal to the patient. Don't give dreamy picture.
That is very important. Yes. So never give a dreamy picture. Whatever is the exact scenario of whatever the anatomy, with regards to anatomy, with regards to the improvement, what we are expecting for the patient is very important to be discussed with the parent, because this is not just one time surgery, it's done and it's over. It's a long time engagement with the patient,
Exactly.
pre and most importantly post surgically. Right, that's true. Another thing I want to ask you, ma'am, is how different were you as a cochlear implant surgeon then, and now how you are a cochlear implant surgeon differently now? Like after being 5 years down the line, when you see 5 years before and 5 years now, what has changed?
Previously, I think I used to give more attention in the surgical steps, like drilling the bed, making the cochleostomy, putting the electrode, which I still give, but now I am more concerned result oriented. How the mapping is being done, what should be the goal, how many words the child should learn after certain age, how early I can do, can I convince the patient at the age of 1 year itself. And I am doing more on postlingual candidates, adult candidates, those who have lost hearing due to autoimmune disease, ANSD. So these grey areas I am exploring more now.
So the learning curve never ends.
No, never.
Whether you are a newbie cochlear
I
implant
am
surgeon.
still newbie only.
That we would want to differ on that.
No, I am newbie, very much.
Now another thing I want to ask you, ma'am. Now we very well know that she is a gold medalist during her MBBS days. She was a gold medalist in her postgraduate days. She has won many awards for many conferences. Now this was you during your academic days, and now when you enter into a private practice, how different it is from being so good at academics and then being equally good professionally. How different these two things are, because I think getting into a private practice is altogether a different game. Everybody talks about it, but nobody wants to discuss the intricate scenarios or the intricate difficulties a surgeon would want to.
It is about communication skill, how well you interact with your patient. There were the days when doctors used to be seen like God, or there used to be a huge gap between patient and doctor. I think that gap is coming down. Now doctors have to be friendly enough, approachable enough, and people have a lot of information in hand already. When before coming to you itself, they know what is sinus surgery, what is cochlear implant. So you also have to behave like that. You have to understand the person sitting on the other side of the table, understand little bit from their socioeconomic status, their education level, basically you have to read mind of your patients. Accordingly, you have to talk to them, and you have to provide all information and options and make their opinion in the decision making. We are not the decision maker anymore.
Yes.
Doctor साहब आप बता दो क्या सही है. I say I don't know. These are the options available. You have to decide. So that is important, that the decision should be by doctor and patient both. Second is, I don't know about others' theory. I have been always very, very truthful to my patient. I don't do unethical surgeries, unnecessary surgeries, not even a single step extra which I feel is not needed. And I give, if I fail to give a result, I admit that this has not worked how I thought. This needs a revision, or this needs a senior's attention. I bluntly admit that. I never try to hide that. These things have helped me, rather than listening from another surgeon saying that it was done wrong, you admit because we are human beings, we will do faults.
Yes.
With best effort, best training also, there will be wrong decision making, there will be technical fault, or sometimes because of patient factor the healing may not be good.
Yes.
Be upfront and tell them, you see, look, this is what I tried but it went in this way, and then try to tell them the solution. Don't ever hide the facts from them.
Right, absolutely right. Last but not the least, ma'am.
Another thing, you have to be smart in private practice.
Yes, we would want to know all those secrets of running a successful private practice.
That smartness is not taught at all in our academic life, which is wrong. It should be. I guess nowadays in MBBS they are including about patient communicating with the attendant. There are case studies and professors are teaching that how to say a patient has cancer, how to say your patient died, how to when you are seeing a referral of other consultant, how much responsibility you should also take. These are the things should be taught during MBBS days, during master degree, and how to navigate in corporate practice, how to build up your own setup. Some kind of financial training should be also given to the doctors, which is a big, I didn't have any training, I had to learn.
Right, I think that is never taught, or that is never been a part of our practice.
It should be taught in the basic part as well.
Right, that is true. Because once you get out of your academic life, when you start as a surgeon, I think a lot of financial investments with regards to instruments. We want to start your own setup, or if you want to venture into, as you are into a CIS surgery and a sleep apnea surgeon, every time you are not lucky to have a full established setup where you'll have all the instruments available.
It's a huge investment on equipments. Some are lucky they join in an institute where everything may be there, like AIMS or PGH Chandigarh or big medical college. Some colleges doesn't have, some corporates don't have. So it's a long journey, and that's why again you need to build up a team from your city, and every city's scenario is different. Practicing in Kolkata would have been different than practicing in Hyderabad, then Pune will be different. Every metro city in India has a different model of practice. So you have to learn where the area where you are staying, what model is going on there, get adequate information from colleagues, seniors, do your homework before selecting where you will start your clinic or which hospital you will join. Nothing comes randomly. Success does not come random.
Yes.
On these also you have to do a deep research work.
Right. So unless and until you seek it, you are not going to.
No, it is not everything. Everything is not destiny. People think like that. Oh, he or she joined there and the practice became so good. Maybe the hospital gets a lot of patients. No, there is a lot of thing going under the
lot of efforts are into establishing yourself.
You have to be smart to select your initial day practice, where you want to start, under whom you want to start, what team you will work with, how is the anesthesia team, and don't get bulldozed by the corporate either. Corporates are good, bad, both kind of team are there. So you should not be full out of them. You should make a proper MOU. What percentage they are promising you, what salary they are promising you, when you should have the hike, how much leave you should have. Especially ladies have a lot of inhibition to talk on these things, which I also had. But slowly I overcome that. You have to overcome that. You don't have any inhibition. Understand your worth. Whatever training you got, how you came from childhood, we are studying and studying. We got through medical entrance, we got through master degree entrance, and what extensive training we got to reach here. Always remind yourself that you are worth of this. So do not underestimate yourself and do not go for less. Settle for. Yeah, so you should be very clear while joining itself.
Right.
That this is what I want and is it written or not. Otherwise it is difficult. It can be kicked out or it can be.
So I think that is the reason why ma'am has made a mark in this field in spite of all the big stalwarts in the city like Hyderabad, and she's definitely, that's the reason she's already a big
should go to some extent my husband also. Yes, in initial days, when I was so knowledge, and if I got a call from any hospital or any company and I wouldn't know how to talk to them, or so I used to put the phone on speaker and ask my husband, please be with me. And then he is engineer and he is in corporate. They know this culture better than us. And then he used to say me that no, this person is not meaning what he is saying, or this guy is not interested, or this is not the professional way of commitment. You have to have a written format. So make yourself open-minded. Have a big open heart to learn from anybody.
Yes.
It can be engineer. It can be your industrial friends whom I learn a lot from, the medical equipments what we use. It can be from your pharma friends, from the MR. I try to learn from everybody. So be open. You are, as you said, yes, I was only an academic person. I knew how to read big books, remember and apply that and answer that in exam. And I had that concentration power that yes, okay, I have to learn this, I can learn this. But these things I learned from friends in different areas.
Yes.
So never think that उससे क्या सीखेंगे, उससे सीखना है.
So it might not be a direct correlation, but
No.
yes, somewhere it has made a contribution somewhere
A lot,
to progress
a lot.
further in life.
A
right?
lot.
Yes.
This pharma company friends, this audiology team, and they also will give you a lot of good suggestion that should you start the practice here, or how you can increase your practice, how you can spread your name, digital marketing help you have to get. You have to be very social. Very social in a friendly way, interactive with lot of people.
Communication
and build a strong network.
Yeah.
You cannot say, okay, 9 to 5 I went to hospital, now I am done. No, you have to go little beyond that.
I think a surgeon's work never ends.
You have to go to conferences, not only to learn but also to meet surgeons from different part of country, how they are doing, what is their thought process, where we are lagging. Similarly, industry friends are very important. If you want to progress, you must have a very strong connection with the medical industry, device industry. Without technology, we are nothing now.
Nothing. Yes, right. That is true. So now, last but not the least, what would be
You
your...
are like pro interview. How many you have done before?
So I think I am
I
just...
thought you were a surgeon, but looks like you are a media person.
No, so now I think I'm just following the baby steps of Dr. Sampurna Ghosh ma'am. She is an inspiration and a motivation to me. I think looking at her, I think no young ENT female surgeon would think that this is a difficult pathway to go ahead. Everything just looks like a rose pathway. I mean, that's very easy. Now I want to ask you, like, last but not the least question, like, what would be your take-home message to all the young female surgeons, because we never talk about this, so many females doing great in their respective fields in all the subspecialties of ENT. So what is your message to them to establish themselves and make a name of them?
Forget about your gender. Never think whether you are male or female at all. What is the difference? Not much. Only that we can give birth to a child. Otherwise, there is no difference. That is a more power to us.
Yes.
Otherwise, everything is same. So you don't at all consider yourself as male or female anything. Consider yourself as professional and follow your dream. That's it.
I mean, that's a very short, crisp and clear message. I think this would act as a guide to many females like me, like Dr. Aishwarya, Dr. Alina, all her fellow residents who are really
Don't
lucky.
even utter male, female, lady surgeon. Don't even, these are not needed. Consider yourself as surgeon. Consider yourself as doctor. And then whatever you want to do, you do that.
Yes, absolutely true. Right. Thank you so much. I'm really thankful to you, Dr. Sampurna Ghosh ma'am, for giving us your time after a hectic schedule of running a marathon of surgeries with a very difficult CI surgery in the morning, and then after that back-to-back surgeries, and still she is here to guide us. Thank you once again.